Welcome back to our channel, Humans of Medicine. In today's lecture, we are going to briefly talk about alkalosis and acidosis, a really critical health issue and a medical emergency which needs urgent attention. Otherwise, it could lead to fatality or other comorbidities that can compromise the quality of life. So, in today's brief YouTube video, we're going to talk about these in a way where it would stick in your neuron and perhaps you would get the concept in a way that you're never going to forget. So, starting off with the question, what is acidosis and alkalosis? And the question that should arise from this should be, what are they? And we need to know what determines being acidotic or alkalotic, what causes them, reasons behind them, and last but not least, how to prevent them from happening. Sometimes it would be under our control and lifestyle, but sometimes it could be way beyond our control and would have a reason, significant reason of some underlying health issues like diabetes or some respiratory issues. So I'm not going to make this lecture too fancy because the main aim is to make sure that you get the concept, and that is why you may not find those fancy animations, but you would certainly find this video helpful in getting the concept of these two. So starting off with the acidosis, acidosis occurs when there is an excess acid. Obviously, you would understand that acid means excess acid, and acidosis would lead to the term acidosis because we have lower pH and high acid quantity in our blood, and we have decreased levels of bicarbonate in our blood as well. Usually our blood should be having more bicarbonates, and the hydrogen ions should be removed from the body by excreting them through kidneys. Um, but in cases like acidosis, the bicarbonate is not adequate enough to cater or neutralize the hydrogen ions, and this leads to high acid in the blood and thus acidosis. The causes of acidosis would include metabolic acidosis. As I mentioned, if we are not excreting or neutralizing enough hydrogen ions, then we may have issues, and then we will call it metabolic acidosis because we don't have enough hydrogen ions. In case of lungs disease, sorry, we would call it a respiratory acidosis because we cannot provide or ventilate enough carbon dioxide from our systems, and in that case we will have a respiratory acidosis. Symptoms that you would usually see if somebody is having a metabolic acidosis is tachycardia, which means they will have a heartbeat of more than 100 beats per minute. They'll be very tired and confused, maybe slightly dizzy. Their appetite would be compromised. They would probably feel full, and their breath would smell sweet or fruity. In medical terms, we call it Kussmaul breathing, and that's one big giveaway if somebody is having a metabolic acidosis, or in other words, we call it diabetic ketoacidosis. This is one big sign that you should pick up straight away, get them checked, and provide them with the adequate treatment. They will be hyperventilating or they'll be taking deep breaths. They'll be gasping for air. Sometimes you would see them vomiting or they would feel nauseous. They may have persistent headache and they may have weakness in their muscles. Um, the real world example I've already provided you is the uncontrolled diabetic ketoacidosis, which leads to metabolic acidosis because our liver produces hell loads of ketones and the uh, butyric acid, and that increases the pH of our blood, and insulin uh, cannot be produced, so the gluconeogenesis work starts, lipids breaks down, and that creates a whole lot of havoc and wreck in the body. On the other hand, alkalosis would, as the name suggests, means we have a high pH greater than 7, and this would be due to the increase of alkaline or bicarbonate in our blood or in our system, or a decrease in carbon dioxide. So we may not be exchanging enough gas at the alveoli level. We may not be expelling the amount of carbon dioxide. Uh, we may be expelling too much due to hyperventilation. I apologize. We may be expelling too much carbon dioxide through our lungs, and that would mean we will have lower, or our blood pH would go to a point where it's called alkaline. Main causes of metabolic alkalosis would be excessive vomiting, or diuretic use like thiazide, fusimide. They are the ones that we use usually for kidney infections, or when we feel like we need to get rid of certain elements. And the loop diuretics, or the tubule diuretics. In this case, if we're talking about the thiazide, that's distal convoluted tubule diuretic, and fusimide is ascending loop of Henle diuretic, which blocks certain channels and increases the excretion of certain elements. Um, so hyperventilation means quickly breathing using of accessory muscles, and sometimes you would see these people having a barrel chest. That means that our rate of oxygenation is less than we are expelling the carbon dioxide. So more carbon dioxide gets expelled, reduces in the blood, and the pH of the blood goes up towards the alkalosis side. Typical symptoms in metabolic alkalosis would be confusion, again similar to what we will have in our acidosis. Because these are thiazides, or these are the diuretics, so there is a significant chance that the potassium levels might be reduced. Usually, if somebody is hypertensive and they are using a hypertension medicine, say X4H, a hydrochlorothiazide, they usually end up having lower potassium in their blood works when the foot blood count is done, and that is typical finding in them, and that should raise significant alarm if the potassium levels go too high or too low, because both of them can cause abnormal heart rhythms. Then they will be uh, hyperventilating as a compensatory mechanism. The causes are obviously antacids of the sodium bicarb, reduced amount of hydrogen ions. They would feel irritable or dizzy. They would feel nausea and vomiting, and they might have a diarrhea, and they might even have anxiety and seizures. That's strange but true. We've seen them in our life, in our profession. Then twitching, tremors, and muscle cramps are pretty common because the calcium gets excreted as well. So the serum calcium, if we usually would absorb significant calcium when our calcium levels are low, but when somebody's using diuretics, that can be one loss, big loss of calcium, which could lead to twitching and tremors, because the calcium is the main reason why we have muscle contractions and relaxations. So in this case, if we have low calcium, the calcium gated ion channels wouldn't open, and ultimately it would cause sort of twitching and tremor. Um, Panic attack would also lead to respiratory alkalosis, because you would obviously see how when people have a panic attack, they start breathing shallow, and they try to breathe fast, and they try to expel a lot of carbon dioxide, and that leads to alkalosis because we have now reduced amount of carbon dioxide in our system. Typically, if we look at ABGs, the pH value for a normal uh, arterial blood should be between 7.35 to 7.45, give or take a little here and there. But as soon as we are talking about going down to 6.8, it means we are moving towards a really difficult situation. Likewise, this situation we would call it an acidosis. You know at this stage that neutral pH is 7. Anything less than 7 is deemed as an acid, and then anything above 7 is a base or alkaline. Now again, if we move from 7.45 towards 7.88, then we are heading towards a disaster. So usually if it goes lower than that, then the chances are that the patient is going to head into coma, and that's not desirable. So keep in mind the normal range is 7.35 to 7.45, and I'm going to give you a procedure of how we can remember these values so we can just quickly determine if they have an acidosis or alkalosis, what kind, and is there any compensatory mechanism happening or not. The normal ABG values, as mentioned before, is 7.35 to 7.45 for the pH. Now remember, 7.35 to 7.45, what makes it easy to remember the arterial carbon dioxide pressure is that 0.35 and 0.45 for pH, 35 to 45 mmHg for the arterial pressure of carbon dioxide, and bicarbonate, you have to remember this, is 22 to 28. That just you have to learn, but other than that, the pH and PCA2 kind of give you a common value. You just have to work out your way to remember them. Another thing that I would really like you to have a look is looking at the first uncompensated acidosis and alkalosis chart, and that would show you that the pH value in respiratory acidosis goes down toward the acidic side. At the same time, the carbon dioxide value goes up. The bicarbonate value stays same, usually normal, doesn't budge too much in respiratory acidosis or alkalosis. Likewise, if we go towards the alkalosis, the pH is going up towards alkaline side greater than 7.45, and the carbon dioxide is going downwards. What we get here is that when pH in respiratory alkalosis or acidosis, the pH and the carbon dioxide are going in opposite direction. And when it comes to the metabolic acidosis, the pH and the bicarb are moving in the same direction. So that comes to a memory trick called Rome. Rome you can remember by this leaning tower of Pisa, which is not leaning here, but it's like respiratory is opposite, like the pH and the carbon dioxide are moving in opposite direction, and in metabolic the pH and bicarb are moving in the same direction. Now it is quite easy to remember that the carbon dioxide is going to be related to the pH, and carbon dioxide to resp, and the bicarb to the pH, and this is uncompensated. If you can see abnormal values of bicarbonate or in respiratory acidosis, it means it's getting compensated, and if you see the abnormal values of carbon dioxide in metabolic acidosis and alkalosis, that means it is getting compensated. That's a brief summary. I'll leave it to you, take a screenshot, and that would give you a good reminder. Uh, Thank you so much for your time and watching this video. I hope you liked it. Don't forget to subscribe, like, and our channel and press the bell icon for future videos like these. Thank you very much for today.